All right. Hello, everyone. We continue our class. Today, I'm going to show you pubis symphysis. We also work on those hips, if uneven hips. It's one hip. If your pubis symphysis is not balanced, it's like slided right in the front, and it's sometimes painful. This is the very, very easy to correct that. Sometimes it's click. Make sure it's non-painful. What we're doing here, we bring this legs up in this 45 degrees. Get this up here. The distance between the foot is probably like a fist. Don't put them together. Some people put them foot together. It's really hard for people to squeeze that. But now you separate that leg. You're going to let the customer know. You're not just going to do that. And you place that arm. You see my elbow is coming in one leg and my palm in another. And you hold it. Now you ask the client, squeeze, squeeze. Also, what you're going to check, which muscle is weaker, which muscle is stronger. I'm probably going to go this way because it's easy for me. And squeeze, 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 squeeze. Sometimes you feel the pop. Is there any pain? No. Sometimes it's pain in between your legs, and you start a little bit rotated. This is the great exercise for balancing those hips. And Daniel, he asked me this, if the hip is uneven. He watched this on Eric Dalton channel. So he's doing this, let's say you got this rotation and this ilium is kind of rotate up or like this way. So it's rotated more up. Mm-hmm. What you're doing here, let's say that one is up. So left one, close to me. It's going to be the best one to show in that one. You'll see it, yeah. Yeah, you do. He asked question how you test it. PS or AS, correct? AS. Yeah, OS, the front one, not the posterior one. So you come in up here and you can see. Come over here. You can actually have it. So come over up here and tell me. Yeah, define those anterior sacroiliac bone.
But does he have dominant eye here?
Yeah, dominant eye. You see, you got it. So we gotta stay. Yeah, if your dominant eye, it's the right. Yeah, you have to stay on the right. You see, we already learned something good. So which one is higher?
Which one is higher?
I'm talking about not this way, that way.
So how you determine that? This was my question. Like, okay, so
yeah, you can see it.
By like what is higher and what is lower, like in these dimensions.
Yeah, it's dimension exactly. You see there any rotation in the hip? This one is even now because we corrected. Yeah.
I mean, so this is lower, this is higher.
Yeah, exactly. So this is lower, this is the higher. So this is how you see it, and so we're gonna work on that higher side.
This is my right side.
Yeah, the right side is higher, so we're gonna work on the right side. But for the video, I'm gonna work on the left side because I don't want to stay my butt there.
Oh, I see.
Yeah. So the side is treatment, this one, but I'm gonna show you on that side. So this great treatment, you're gonna bring this leg again in 45 degrees.
I put my head on that side.
Yeah, that's fine. Yeah, we can do that, but for the video, the legs is 45 degrees. This is the neutral position. Now that side supposed to come inside, the non-treated side. So you bring this in the middle. You see it's come closer. Now I lift this leg up in the air. This arm is going to scoop in here under that left, after the left knee, and right in here. Place that on that knee. So you see I'm supported. This arm is coming on the top of that ankle. Okay? And what we're doing here, we'll lift it up and we'll lift it 45 degrees. So this is the 45 degrees. I lift it up. I push this arm down and lift with my shoulder. You see, I'm going to find it, lift, and now I ask David to push down. Push your hip down. So he pushed that butt down. Let it go, relax, and I pull more. And this is what I'm doing here. Okay, now You can remeasure, but before
You
remeasure,
made David even more uneven right now.
yeah, it's probably uneven more. Yeah, you can see. Look at that. This one is really like, yeah,
It's worse.
it's
You're welcome, David.
yeah. So now you're gonna do because you're gonna do other side now.
You get worse.
Yeah. Now you do that side for the practice.
Okay.
So he's standing on that side. Bring it up.
Okay.
This one, don't forget to put in towards the midline. Here we go. This one on the top. He's coming under. Let me get that. Camera is good. Let me get this camera. And you push down. Here we go. Look at this, what he's doing. You see, he lift that hip up. And, like kind of cross 45. Towards. Don't work so hard. You just kind of like lift.
So
And
is he doing it right?
yeah, he's going to shift it. Yeah, he's good. And hold it and ask him to push down.
Push down now, David.
This arm is going to be a little bit close on the
Like here?
ankle. On the ankle.
You pushing?
Push down. Yeah, push down. If you don't
How
feel
many
push,
seconds? Like what?
1, 2, 3, 4,
And
5,
relax.
and relax. So you can do 3, 4, 2
And then
times.
and then I'm
Do
doing
one
even-
more time. Yeah. 1, 2, 3, 4, 5, and relax and let it go. This is great for those SI joints, for all those iliums, all this pain, stiffness in the back. This is the great exercise. I mean, treatment. Keep it low, and let it go. Perfect. Let's remeasure. And go ahead.
On David, it's super easy.
Yeah, it's easy.
His bones was made for that.
Yeah, he was being born for being practiced for massage.
Because
So-
for some people, it's kind of hard to find these bones.
Really?
For me, yeah.
It's just
But
practice.
It's better. I still see the difference, but
It just practice. It just practice.
Because
Yeah.
some people are hard to find. Is it because they're the weight?
wait, sometimes they like in the jeans with the belt and.
Yeah, you remove the belt. Yeah, I ask him to remove the belt, or sometimes, if you don't do standing, you put them on the table, underwear, and just test this way. Remember, we get another test when you flip people on that prone position when he's on his belly, and you pull his leg inside, and you can test all same thing. It's gonna tell you. Yeah, you can.
So we just keep on in these directions and this. Right?
Yeah, correct. And it's you can also work on that. Remember, we have the scar. We work on this PSOS muscle. Release that one. We can pull that one. Now I want to talk about this internal rotation of the hip. A lot of people don't pay attention to this. Like the clients also I see how my client is laid down. So if you step a little bit on the side, I want to show him. You see his leg is very straight. This one is kind of on the side. You see this like a pointing to the side? So that's mean he's like rotated this way. Exactly. So he got this internal rotation of the hip right in here. It could be like normal, but we're gonna test it. So this is the easy way to test. You bring this to the 90-90, you hold that knee, you not push too hard, you not jam, you just hold it very lightly, and you start pushing that foot on the side. We're looking for 30-35 degrees. It's not 30-35, and I feel that restriction. Sometimes when you push a little bit more, you can feel that. Because it's motor control problem possibility, but for David, I'm already know it's going to be the mobility problem, and I'm going to show you how we can work on it and get this huge improvements. This is really great exercise. The treatment, we've done this many times. The arm is coming here, right in here, under this knee. The one on the top, you see, I'm holding it and I'm lean on that knee. I'm stick that femoral bone inside that
It feels so good.
acetabular. Yeah, of course. And it's a lot of inflammation. We sit a lot, and when you stick that, hold it 90 seconds. You see, if you're a woman, put some pillow up here, breathe, and just hold it. Just enjoy whatever. How's your day going? I usually talk, like, if people don't want to talk, I don't talk. So it just depends on clients. How do you feel?
This feels very relaxing.
Very
on
relaxing.
the joint and the hip.
Now I start doing this. You see, I use my legs. It looks like I'm using my body, but I'm just kind of dancing. I'm doing this. I'm doing this move.
Like a hula hoop.
Hulu, yeah, like and you see, it's my whole body. It just is because if you're gonna do with your arm, you're gonna get tired. You need to get that learn mechanic. So you see, I'm lean and I'm just do hulu. My arms is just supported, and I have to go slowly for the camera purpose. I show that quick. The Daniel is gonna work on that right one. I'm working on the left. You can do active. He can resist me. So put this more internal rotation. So he's gonna push against my arm. So you see, I push it towards me. He's gonna push that back. Resist me against my arm. 1, 2, 3, 4, 5. Always tell the client don't push too hard because sometimes people like push that hard. You're gonna like fly through the table. Yeah, I asked that football player like contract your biceps, and he's like basically lift me up with his arm because I always say 10%, 20%, and let's work again.
I've always had a problem with internal rotation my whole life on these hips.
So you have to train him. You have to give him bands. You have to reactivate those muscles.
It's been doing better in the class.
Good. Yeah, of course. That's why you join Zaratka class every morning. And look at that. How many minutes? Like one. It's going to be 2 minutes and 20 seconds. So let's do another 20 seconds and I show you 2 minutes. So get this a little bit more. Push against me again. So what he's doing, he's trying to get this leg back towards the midline from lateral to medial. And I'm resisted with my elbow. You see, he pushed against my elbow. My elbow is here. See, I'm control it. I'm lean it. He push inside. Any pain?
No.
Let it go. No pain. Remember. And
It does feel good.
of course. And release. Let's retest it. Is that 30 now? It's 30 now.
Wow, I don't think I've ever had 30.
Exactly. This one is a little bit limited. We need to get to 40. Ankle, need to be working ankle.
Is my ankle not good?
Yeah, it's a little bit better than last time. There was last time. So, okay, go ahead and check the right one.
But you're not impressed with my ankles.
I'm not impressed with you at all.
While I'm working on David, could you let me know, yesterday I had a client like who is over flexible. So
Yes.
he was overdoing all the tests, but he
Yeah.
still had the problem with his back.
Yes.
Like, by what he described, I would assume it's SI joint, but
He's hypermobile.
all the tests I did, he was hypermobile.
Yes. It's a lot of people. It's not a lot of people. It's some hypermobile people.
So you're gonna hold down.
Push down and hold it
Now,
like
he's
this.
pushing with his chest down.
Okay.
Yeah.
I don't want you to. So
how-
what, Yuri? How do you put your weight on it without it bothering his chest?
It's right here. I lean on it. If not, you can just lower the table down.
So
If you do portable table,
keep the
yeah.
pressure for what, 90 seconds or?
Yeah, 90 seconds. And the thing is, when people go to the houses, do portable massage, they always bring the table so high. It's like that high, and they can't reach it. So that's why I keep my table. This is my table. This is
Wow.
this is my always table. I like to lean. I like to lean on my body. I'm on my let's say pray. I don't call customer pray. Yeah. You might pray. I'm just kidding. Of course. That's why I want to use my body weight for my clients, for my patients, and make it easy for me, and it's good for them. Look at this. When you lean with this body, if I'm gonna do only with my arms, I'm not gonna put so much pressure, and he's not gonna feel much, right? So exactly. I mean, even if you like, I mean, if you maybe 400 pounds person, yeah, maybe. Here we go. And very like light. Keep leaning.
Do you vary your pressure when you do it this way?
You do only light pressure. You don't push too much. It's like always communicate with your clients, and depends on the person. if they already have pain inside the joints, very, very careful. And if he have artificial joints, I will be super careful. I might not do a lot of those rotations, just very light movements. Just make that blood go through all this, break this adhesion around the joints, and just make the people feel better, move better. There we go. Yeah. And try to ask him to resist. So bring to this first barrier. Always find that barrier.
Okay, doing like this.
Mm-hmm.
So I resist this way.
Then I'm gonna push.
Yeah.
Okay, and you're gonna push.
It's actually. I'll show you the easy way. Hold on. I usually you make, because here it's gonna be hard for you. You come up here. You see?
Okay.
Yeah. This is easy, because if you hold this way, it's hard for you. You see? But this is easy. Boom. You hold it. Yeah. And as you lean, you see it right there.
I see. So when you're leaning,
Yeah, this arm, if this is the right, it's a right leg, your right arm inside. So right arm, right leg, right arm inside. You go inside, you grab that inside. There we go, much better, right? Easier. So much easier, exactly. Because when I go to school, they show you all this effleurage, pétrissage, and you get tired. You get this tree massage and you're tired, and like, what the hell is going on? But when I go to those different classes from those masters guys, they show you like, hey, you work too hard. You're not supposed to work so hard, because
Push
you.
against me.
1,
2, 3, 4, 5, and relax. And then I'm
And you
pushing
bring a
more.
little bit more. Yeah, you bring a little bit more, just a little bit more. And
I'm
we can.
asking to resist again or not?
Yeah. You can do several times. You can do several times.
1,
Mm-hmm.
3, 4, 5, and relax.
Perfect. Yeah, sorry that Daniel is like on the camera, but you already saw the first one. Remember, the arm's coming inside. So the arm is coming, you bring this arm, the left arm, left leg, left arm. So this is how connected, you see? And you come in inside, it's come from inside. Boom, that's it. And you hold it. And from here you can do distraction, you can pull, and that's the key. Here we go. And look at that. It's just, yeah.
it's good.
Yeah, and I saw that the Japanese guy do this adjustment. Did you see that one? He's ripped the person out. I don't know how they do it. I'm not going to show you. No, David make a joke on my eye, so I'm going to make joke on his hip now. I'm just kidding. So the ladies bring this leg like this, butterfly. She hold it, and after she's like, push it down. Yeah.
That can rip.
I know, but she's adjusted and person say it's feel amazing. No. Don't do that stuff. You're a massage therapist. That's the video about. Do not do that crap, because you don't know how to do this. You not go through the university. You don't go through the college. You don't finish those 4 years of adjustment program. So don't do that, okay? Just don't cross your scope of practice, because a lot of people do that and you get yourself in trouble. You get sued. Have a good day.
It's good. It's good.
Okay, what else we can do? We still have like 5 minutes, 10 minutes. Oh yeah, you want some ink?
No. How, if I want to build my exercise for my, because I don't have much internal rotation. I have some external, but I want to exercise just to get my foot more internal rotation. What can I do?
Bands. It's applied the bands. So let me.
Take a band.
Yeah, you take a band. So David asked me, he don't have external rotation of the internal rotation. Yes. So.
How strong you are, David?
Oh, this band is very bad.
That's
Yeah.
bad.
I mean, no, it's fine. It's just very heavy.
Yeah,
Oh.
heavier than this one?
I mean, they both heavy. This is
Okay, too
no. This is from China. We can use it. It's from China. They don't have any
Red is
difference.
better than
Like
black.
like look at this
Whoa.
one, and it's almost the same. Yeah, like try it. It
It's
just
a red one. It should be not that strong.
this is just China. They just do whatever. They just different color but the same stiffness.
Is that
Yeah,
Yeah, it's
try.
almost like a black one.
Yeah.
Yeah.
But anyway, I usually go, around that ankle. I come up here, support, and I give him like this exercise. You see I'm hold? Go ahead, rotate, out, in and out. Uh-huh. Yeah, this one is what he's doing here now.
So this is for the out. Oh, I see.
Yeah.
You put that against the door.
Yeah, against the door, and he's rotated. You see, and I bring him more. Yeah, he do it. Also, I'm holding right in here. I hold that tibialis muscle. I'm trying to get separated. If you don't see this on camera, but I do this. You see, yeah, because I'm stay on this side usually, and I can use my fist and just drag that fascia right there.
So I would use this against the door.
Yeah. Next one, I will show you that ankle mobility. So yeah, go ahead, help him out. Continue.
Because all right, I need to.
Yeah,
do
he wants to do different bend, of course.
I need to do.
Yeah, and it's to make him work a little bit. You get this muscle right here. Even look, you don't want to work hard. Put this bend right here. Yeah, exactly. Let them work. Just one. Yeah, one leg, in and side, in and out. And I stay on this side, and I'm working down that tibialis muscle. Look at that. That's great for the runner. So what I'm doing here, I'm working on that muscle, the tibialis anterior. And relax. You can also work on the calves, active release. I love active release. This is the best, active release, because I want the clients feel that muscle. I don't want my muscle to be like a meat on the table and I'm just like doing this. He's gonna get up and he feel good. Release that lactic acids, those whatever toxins, make that fascia a little bit slide, but it's gonna work for 2 days. You want him to feel every single muscle.
So now these are for external rotation.
Yeah.
Do internal rotation. That's when I'm enough to mount it.
Yeah, it's outside, but this is what I do for the ankle. I usually come up here. So I don't know if you guys see. Yeah, you see it. So I come up here. Can you go a little bit on side? And I jam. Look, I'm grab this right in here on the top. I'm holding it. I'm get this between my knee, and I'm start doing this. I can do rotation. You see, I'm dancing side to side. After 2 fingers right in here on that tibia talus joint, and I'm lean forward and try to get that fingers a little bit inside. Sometimes it's very sensitive. People with arthritis, and look at that. You just move around. Again, come back. Move around. You can do up and down. See, and it start moving.
So many people have ankle problems. Do you find?
Oh yeah, it's a lot of people with ankle problem. It's very common. Try to move. Look at that. Look at that.
I've never been able to.
Exactly. No, if we give him homework, he's gonna be okay. He's gonna be fine. Use it or lose it. This is how your brain is work. If you don't use it, you're gonna lose it. He's gonna forget about this. He's not gonna use it. It's all in your brain. This is what we do bands. He's remember now. He's remember there's dorsiflex and plantar flex, that ankle. And that's the key. You see remember how he's talking about my eye? Your eye is like clicking. Look at his ankle. His same thing. He's not smooth. So we need to make that smooth.
That's right. It isn't smooth.
Exactly. So that's how everything works. Get massage regularly. If you're a regular person, if you wants to not spend $1,000 on those doctor surgeries and just came once a month, maintain your body. You need to maintain.
And for plantar fasciitis.
Yeah, I'm not sure if they hear you, but David says plantar fasciitis. Everything. Ankle mobility, the hip mobility. Don't mobilize your knee. A lot of people mobilize that knee. I don't know why you guys doing this? Why are you doing this? It's like, what's that about? If you got knee pain, it doesn't mean your knee is the suspect. It's probably your ankle or your hip the suspect. If something's not working, and that knee get that hard impact. Or you walk like this, like a big age, because you're overweight, because you like tacos and whatever, enchiladas. Taco Tuesday. No, I mean nothing against taco. I love tacos too, but you eat them every day and you eat them with the beans and rice. Yeah, those burritos, amigos. So, what I'm trying to say, strengthening. If you like tacos and burrito, you have to strengthen your glutes to make sure your knee's not going to collapse. Because when you're 20, 25, you're fine. But when you're 40 and you walk like this all the time, you're going to get in trouble. You're going to come in and I'm not sure if we can able to do something about it. Don't wait for so long. Okay, that's about it. You guys have a wonderful day. We'll see you next Tuesday. And if you're in Los Angeles, book massage with us. We'd be glad to help you. David, Daniel, Jay, we're always here in the clinic, and also some people can go to your house and work on you. Book it now. Bye-bye.